So for today's video, we're going to be going over hip flexors. So you want to strengthen them so you can lift up the leg. Couple scenarios. Let's say your car might be a little bit high, so it's high off the ground. You got to lift up that leg to go in your car, and then you can sit down. Even if it's slow, you still have to lift up that leg, up off the ground so you can get into your car and sit down. And you also need that balance on the other leg as you put that foot in the car and then sit down. You can also use your hands to hold on for safety too. So getting into your vehicle, let's say you have to go upstairs and just try to replicate something that's a little bit of the same height as a regular stair. You have to lift up that leg to go up to the stair and then extend to the next stair. So going upstairs, going into your vehicle, let's say your bathtub or your shower, you also have to lift up that leg and bring it up and over into the shower. Let's see, what else? Stairs, shower, chairs, walking. So you want to lift up that leg high enough so you can extend it when you're walking. If you can't bring up that leg high enough and extend it, you see how let me get that out of the way. The toes kind of drag on the floor. So you want to lift up that leg and extend compared to barely lift it up, extend, and your foot is still flying on the floor, causing you a more higher risk of falling. So hip flexion for your walking, stairs, shower, bath, vehicle. Let's see what else. Well, that'll probably be your main functional activities. You're going to be showering daily, whatever times a week, or bathing. You go in your car probably every day. You have to walk every day. If you have stairs, curbs to restaurants. So if you have a curb and you're trying to go to your favorite restaurant, you want to have a better ability to go up on that curb compared to having such a difficulty if you want to go to your favorite places. So that would be hip flexion reasons and activities. And then for just exercising, we'll try and go from supine to sitting to standing, and they're all kind of similar movements. So, laying down on the back, got your knees bent. All you're trying to do is lift up that knee. So we're going from easy to medium to more difficult. So lying on your back, bring that knee up towards your stomach and down. And then just kind of alternate. You want to make sure you hold it at least like 3 seconds. You're not trying to do like marching, like the little marches, just as I'm showing you now, because you're not giving enough time to kind of contract the muscle and stabilize. So it'll be like 1, 2, 3, and alternate. 1, 2, 3. So going from easy, supine, and now if I go into a single leg raise, the same idea. You're trying to use your hip flexors. Straighten out your quadriceps, bring that leg up, just high enough, and down. acting like an anchor to keep it planted, while the other one is doing the hip flexion, bringing that knee up to your chest, and down, and alternate, and that one counts as an anchor. So using a band while they're sitting, just a second, going over here, and same idea while you're standing. Same, holding on, get your counter to something for safety, bringing that knee up to your chest, and down, and just alternate. You just want to make sure that you're going up to at least your waist. You're not going to bring it literally to your chest, that's just the direction. But just bringing it up to your waist, so you're getting that at least 90-degree range of motion, so you can lift up that leg going up the stairs in your car, your shower, your bath, you're walking, just so you have positive floor and step clearance, so you're able to clear the stairs and the floor. And that's pretty much it. So we did supine, so think of laying on your back, spine, so easy to remember it. That'd be the easier, and then you got the sitting, the medium, and then the harder, standing, and then we just went over weight training with them as like progression overload. If they become too easy, just add some resistance around your ankles. But that'll be it for that video going over hip flexion, just because it seems like a lot of senior patients have difficulty lifting up their legs, thus leading to higher risk of falling, just because either their foot catches on something, they can't lift up the leg high enough, so just poor step clearance. So just trying to strengthen the legs to lift up and over so you're not falling, or at least trying to decrease your chance of falling. So hip flexor strengthening and step clearance.